Okay, so the following is a video to help you best recover from your recent surgery, either a medial patello-femoral ligament reconstruction or repair. Now, following this surgery, you will get some pain. You will be managed in a bandage, which will go from about here to here, and you need to keep that bandage on for 3 to 4 days. You'll also be in a splint that will stop your knee bending too far. There's no rush to bend your knee, as that's what can potentially stretch out the graft. So we only do very gentle knee bending with following this surgery. The most important thing for you to consider for the first 48 hours is to try to get the swelling to settle down. So it mainly means resting and elevating your leg. I would suggest use of 2 or 3 pillows that you can stack up on a bed and try to get your knee above the level of your heart. So you're laying down, you'll be managing your splint and bandage, and your leg will hopefully be above the level of your heart, and you'll be doing that for most of the day. This is the best way to get both the pain and swelling to settle down in that immediate post-operative period, and you'll find the more little bits and often you get up, you'll be fine to do that, but just don't overdo it. The most important thing in terms of as well helping the swelling getting down is use of ice on your knee. After 3 or 4 days, when you take your bandage off, you'll be able to use ice for 20 minutes at a time every 2 hours to try and settle down the swelling in your knee. When you're walking, most people will require crutches for the first week or 2 just to take a little bit of weight off of their knee, and it's just really gentle crutch walking and for a short distance. With your knee exercises following this surgery, it is important you don't do too much too soon. Generally, we might start you with just a couple of very, very gentle exercises where you're doing a static exercise of your quadriceps muscles, trying to tighten up the thigh muscle and hold it tense for 5 or 10 seconds, and also some straight leg raises where you may be just lifting up off the level of the bed, in or without the splint, and back down. And you would generally start with these straight away following your surgery, which your physio will go through with you, and you try to keep them up regularly during the day. I would suggest most people start with 5 to 10 repetitions of each exercise and gradually build up over the next few days. There is one other exercise which your surgeon will tell you, if you are allowed to do, is just a very gentle heel slide. Now, because we don't want to bend your knee too far, it's very gentle and it's just within the limits of your pain, so it might only be that 10 or 15 degrees of knee bending out of your splint 3 or 4 times a day. Hopefully that's helped you get off to a good start with your rehabilitation. It's a long, slow process with this surgery, and definitely we don't want to rush to get your knee bending too quickly, so it's very gentle with the exercises. If you do have any questions or worries, your physio or your doctor will be able to answer them. Definitely get in contact with them straight away. Hopefully this has been helpful. Thank you.